Hi everybody, my name is Vivian Wynn. I'm a student at Winston-Salem State University. This is my research proposal for the FilmArray blood culture identification system that help with the patient outcome in patients with bloodstream infection. There is the part that I'm going to cover for this research proposal. The first one. So as a lab technician, we all know how important it is when you have a positive blood culture. You need to work fast, have a fast turnaround time, and an accurate result so the doctor can admit antibiotic for the patient on time without delay of the outcome. This is why I would like to introduce to you the FilmArray blood culture identification system. The system have a higher sensitivity, higher specific, and with the cost compared to the traditional culturing method. The second part is this. So, bloodstream infection, such as sepsis, have very high mortality in not only in the US but also worldwide. It have the leading cause of death in the non-cardiac intensive care unit in the US. Because of that, it have a great financial burden in the hospital in general. Just on this year, there was 1.1 million cases, and it cost us $24.3 billion. The problem with bloodstream infection is it's hard to differentiate between bloodstream infection with other infection. So it is hard to diagnose, and because of that, it can delay the identification of the bacteria and delay the antibiotic treatment, and because of that we have a poor patient outcome. There was a lot of different methods that try to ID the positive blood culture. We have PCR method, we have FISH method, and we have mass spectrometry method. All of them is either fast but not accurate, and vice versa. It's accurate but not fast. And I believe that the FilmArray blood culture identification system is the perfect blend of fast outcome and accurate result. And here is the data. This shows the blood culture ID panel that it can perform. It can ID Gram positive, Gram negative, fungus, and antibiotic resistant. Right now, the amount of bacteria it IDs is just the most common one. I believe in the culture, in the near future, they would extend the panel even more extended. So for the method, I'm gonna be showing you the different how we do the FilmArray system versus the traditional culturing method. So this is the method. So in order to compare these two methods, we're gonna draw one set of blood culture for every patient that will get admitted into the hospital within 1 month. For the FilmArray system, so this is the pouch that will hold the panel. It's called BCID, which is blood culture ID panel. When you open it, there's gonna be a cylinder look like this, and this part gonna house the pouch. The cylinder you can recycle it, so it's environmental friendly. When you open it, there's the pouch which have two parts. This is the red part and this is the blue part. The red part is for the sample mix and the blue part is the hydration. You can also put the patient ID here. So on the blue part, which is the hydration pouch, we have the hydration vial. What you need to do is twist it, push it into the well, push it down, so the fluid will roll into the pouch. Onto the red part, which is the sample mix part, you have something similar, sample vial. I'm gonna put this in here. Notice that this part is open. So on the red part, which is the sample mix, you're gonna have the sample buffer. Gently squeeze the sample buffer, the whole vial, onto this area, along with 0.2 ml of the positive blood culture from the patient blood culture bottle. You're gonna close it, mix it 3 times, put it back in, close this one, push it hard so the fluid gonna get raw onto the pouch. When all this is done, you're gonna put the whole pouch, load the whole thing onto the system. It's that easy. It should take you less than 5 minutes to load the whole thing. So once you start running the pouch, it takes around 1 hour to give us the result. There will also be the control run alongside with your patient sample. If the control say invalid, unfortunately you have to repeat the test. So just be careful with the technique, but it should be easy to use and give you a fast result. Alongside with that, the traditional culturing method, you're gonna do the same way, which is when the positive blood culture appears, you're gonna do a RAM stand. Once you ID the what type of bacteria you have, RAM positive, RAM not negative, fungus, yeast, you can start blading the agar blade that correlate to what kind of bacteria you have. And after that, you're gonna ID the bacteria by microscan, which is gonna take us average of 24 to 72 hours. In conclusion, the traditional culturing method and the FilmArray blood culture identification method should give us very similar results. The positive side is the FilmArray should give you a more accurate result in a faster time, and the doctor should be able to give patient antibiotic a lot faster compared to the traditional culturing method. This is the reason why I think that we should be in favor of the FilmArray blood culture identification system. That is all for my presentation. I hope you enjoy it, and thank you for listening.